Good morning, one and all. So, welcome to the ERCP training at Ramaya Memorial Hospitals, Bengaluru. So, this is one of the part on language of ERCP. So, the first part is basically dealing with the disinfection, that is cleaning, disinfection, and sterilization of the endoscope, endoscopic accessories, and the concept of the endo washer. So, whenever we deal about steps of disinfection, the disinfection step starts from withdrawal of the endoscope, pre-cleaning at the bedside, leakage testing, manual and machine cleaning, disinfection, rinsing, and how are you going to store the different scopes. So whenever we say about a pre-cleaning, so there can be an ultrasonic cleaning that can be done for about 30 seconds, 30 minutes or with the detergent to remove the debris. We should always brush the tip of the endoscope because that is where majority of the secretions as well as debris can get accumulated when doing the endoscopy. All the channels should be brushed clean for removing all the debris of the previous patient. So it's always better to rinse the scope under running water because always rinsing the scope will always remove the debris as well as the detergent. We should use always a cloth, not cotton, so to remove the debris along with water. We should always check the water as well as the air channel, and we should always disconnect the suction channels as well as the biopsy port wall and place them in the detergent solution, and we should wash them using a small brush separately. Before we put it for a machine cleaning, the most important thing is we should always check the scope for any leakage testing, even for a routine scopy or even after an endoscope which has been used for a therapeutic purpose. Leakage testing is done by a leakage tester which is connected, the proximal part connected to the processor, and then we are going to check the air that is coming from the processor, and we are going to connect the other end of the leakage tester to the venting connector of the scope. So then we are going to immerse the complete scope within the water, and then we are going to see whether there is any expansion of the rubber at the tip of the scope. So that is very important because from outside only when we are seeing expansion of rubber, that means there is some leakage that is happening. Once we immerse the entire scope within the water, if at all the bubbles are coming, that means there is a leakage that is there. We need to angulate the scope, that is using the big wheel up and down, such that if at all there are any small leaks that can be that can come out and bubbles can come out and leakage test will be positive. We should always dip the scope for the entire minute time because for the air to get accumulated within the scope as well as for the bubbles to manifest. So it's always better to keep immediately for a minute and then wash for the bubbles. If noted, immediately remove the scope from the water. Don't keep on looking at the bubbles. So immediately you remove the scope from the water. Then you remove the once the scope is removed from water, that is leak is positive, you remove the tester from the scope. So that is very important. Don't switch off the monitor immediately. So because there will be a suction type of a thing that will happen. So once you remove the scope from the water, then you remove the tester, then you switch off the monitor. And then you call the whatever the company person, Olympus or Pentats, for taking the scope for repair. So that is for the leakage tester. You can clean, different types of cleaning is there. One is machine cleaning or a manual cleaning. Manual cleaning can be done by the patient side where 3 tubs will be placed. Each one can be color coded. The middle tub will be with the sterile water which is changed between the patients because we don't want the patient secretions or the debris contaminating between the patients. So we should always change the sterile water. The second tub is with a multi-enzyme cleaner, so because that will act like a sterilization sort of cleaning as well as brushing all the ports. And then the last one will be a disinfectant solution which is predominantly a 2% glutaraldehyde, that is for disinfection. Cleaning the scope, once immediately coming out of the patient, we should immerse the entire scope in water after wiping the exterior of the surface. Then we need to use a suction cleaning adapter, by connecting the suction cleaning adapter to the different ports, and then we aspirate and flush the suction pump using a syringe. So usually we tend to use a 20 ml syringe rather than a 50 ml syringe because the 20 ml syringe will give you adequate force to push. If you use a larger caliber syringe, the amount of force generated at the tip of the syringe will be much less. You can use a scope cleaning brush which comes with 2 different sizes. One is a longer tube which is around 240 or 200 centimeter. The second one is a smaller tube which will be around 10 to 15 centimeter with a brush at both ends. So whenever we use a longer channel, we use through the biopsy port as well as from the channel port. We use a to and fro movement such that if at all any debris is connected to the biopsy port, so that will be removed completely. So we should always use a brush single times, but majority of the time we use for 3 or 4 cases because these are all little costly instruments. Sterilization can be done like by using multiple. One is ethylene oxide, second one is hydrogen peroxide. Liquid chemical sterilants can be used, PAA or glutaraldehyde or autoclave. Predominantly the accessories are done by ethylene oxide as well as autoclaving. By endoscope, as far as the reprocessing is used, like we tend to use the multi-enzyme cleaner as well as Sterling. Endo washer is basically like there is a machine which comes, different companies will come, like Olympus have got, Mitra has got, so which where there is a leakage facility available within the endo washer. So the advantage is we can set the time, how much water, similar to our washing machine. This is a washing machine for the endoscope, so we can look at how much water, how many cycles it needs to be done, like 1 to 20 cycles can be done. Disinfectant also, how much disinfection you want, like 1 to 99 minutes can be done. After that, the advantage of endo washer is it can dry the scope, like by putting in air. The dryness can also, we can adjust by approximately 1 to 10 minutes time. So there is a powerful channel drying mechanism, because at the end the scopes, if they are dry, the chance of water getting sedimented within the biopsy port such that the accessories going freely can be a problem. Before we start the endo washer, we should ensure that all the connections are correctly connected. We should ensure that complete irrigation of all the channels are done. The advantage is because it is a machine, it is reliable as well as reproducible. Whenever we use a open glutaraldehyde, there will be eye, skin as well as nasal irritation. In a machine scenario, it always reduces the exposure of eye, skin and respiratory, and as well as it will improve the endoscopic unit function by disinfection. We can always take a record of each scopes, how many cycles of disinfection has been done. It's not only the endoscope that we need to look at. In an endoscopic unit, we need to look at the accessories also, because majority of the accessories are provided for a single use, but we tend to use like 3 or 4 times, because each accessory can cost 15 to 20,000 rupees. So we tend to always reprocess by either ETO method, that is ethylene oxide, or by autoclaving. So most important thing is, like each accessory comes with, like sphincterotome will come with a metal wire, so we should always bow the sphincterotome and then clean the metal wire completely, because that's where the debris can be there. Whenever there is a debris, the sphincterotome may not function, as well as the durability after autoclaving might not happen. Ethylene oxide will not work if there is any tissue debris of the patient within the accessory. Whenever we call about disinfection, it should be always a high level disinfection that needs to be there. When you tell about high level disinfection, it is all basically vegetative microorganisms, bacteria, fungi, tuberculosis, as well as viruses, either lipid or non-lipid ones. All of them have to be disinfected. So the majority of the agents are either glutaraldehyde or orthopteraldehyde or peracetic acid. These are one of the 3 agents that will be used. Majority of the endoscopic units preferentially use glutaraldehyde. So we immerse the endoscope as well as the accessories into the disinfectant solution, and we need to soak the scope for 2 to 5 minutes in normal case. If at all a person has got any bloodborne virus positive, so then we tend to keep it for a little longer time. After disinfection, before endoscope, so you should always rinse the scope with sterile water, flush all the channels. Suction port channel should be completely with sterile water. Avoid glutaraldehyde contact with the skin and mucosa, because whenever there is a contact of glutaraldehyde, there can be a chance of chemical colitis, because glutaraldehyde is an aldehyde, so it is a strong, like 2% or 5%, so it can be strong and it can cause mucosal ulceration, and it can mimic ulcerative colitis during follow-up. So we should ensure that like there is no glutaraldehyde within the scope or in the air, water or the suction port. So all 3 channels we should be checking. So once we say that the endoscope is completely clean, disinfected, and it is useful for the next person, so we should always like after completing all the procedures, we should always store the scope. Endoscopy should be always stored in standing position, because endoscope waits for the endoscopist, so endoscope should be stored in a standing position. The advantage in standing position is it will remove all the humidity. Even if there is some amount of water which is there within the channel, it is going to fall down because of the effect of gravity. So always the endoscope should be kept cleaned and dried, and it should be stored at a height, because whenever we are taking out the scope, sometimes there can be a chance of trauma to the tip of the scope. The tip of the scope is the most important for all the therapeutic purpose. We should not be storing the endoscope in suitcases, because in suitcase the scope is in a curled position. Sometimes the scope can take that posture. So it's always better to store endoscopes in a standing position. If there is a long scope, the tip of the scope should be protected from the base of the storing cases. That is very important because the lens, the light source, the airborne water port, everything is at the tip. So like it's always better to have a sponge cover in case we feel that assistance may damage the tip of the scope. So lead apron and thyroid stills always should be stored. They should not be like folded and stored. They should be again standard in different standees, such that the lead apron or the lead shields don't break and the efficacy of the lead protection is gone. So we should always check the lead apron, like how much is the efficacy, by looking at the radiation hazard at least once in 6 months or once in a year. So this concludes the first part, which is cleaning disinfection of the endoscope and its accessories.